I'm so excited to be here today chatting with you all. My name is Kat Patterson, like Amy said, and I'm a senior analyst at the Association of State and Territorial Health Officials, or ASTHO. I'm happy to be here to talk with you a little bit about the VoteSAFE Public Health Project, which is committed to promoting healthy communities and advancing health equity by assuring safe voting and participation in the electoral process. So this is definitely an issue that's come up more and more. We've heard a couple of other folks mention that it's an election year, which yes, it very much is. Next slide, please. So the pandemic makes voter participation in elections an especially urgent public health issue. And there's really kind of three reasons that really kind of bring this point home. So the first is that those who are most impacted by COVID-19 are also those who experience the most barriers to voter registration and to voting. So we know that communities of color have been hardest hit by COVID, and we also know that those same communities, those same populations are most likely to be affected by practices like gerrymandering, like voter misinformation and disinformation campaigns. So there's very much overlap between who's impacted by COVID and who struggles to vote and to access the voting process. The second point is that civic engagement and participation in the electoral process through voting is itself an action that impacts health, either as a voter wanting to access the voting process and to cast your ballot, and whether you can do that safely and healthfully, or as election workers and poll workers wanting to operate those sites where people are voting, right, and trying to do that healthfully and safely as well. So there's been a lot of conversation this year about the poll worker workforce in this country is much older than the average, and what that poses in terms of being able to maintain the number of poll sites necessary in order to make voting an actual reasonable practice that people can engage in. And then the third point is that voting is, I would argue, has always been a public health issue, but is especially salient in that voting and poll sites specifically may be vectors for COVID-19 transmission. And that puts it very solidly into the hands of, into the purview of public health. And it was these three specific points that really inspired the establishment of the VoteSAFE Public Health Project. Next slide, please. So the VoteSAFE Public Health Project is a nonpartisan coalition of 10 national public health organizations, all dedicated to this issue of helping citizens vote safely and securely in this election while also reducing or preventing transmission of COVID. The focus areas are providing guidance and public health technical assistance to election officials and others involved in the voting apparatus, everything that goes into that, and making sure that it's safe. The second area is supporting efforts to recruit this expanded workforce, since we have experienced this dip in poll workers of this workforce not feeling safe, right? So seeking to expand that workforce, making sure that it has all of the tools and equipment, including personal protective equipment, in order to do their job safely. The third focus area is coordinating and amplifying communications and education efforts. There's a lot going on. Like I mentioned, there's National Voter Education Week going on. There's Vote Early Day, which happens later this month. So lots and lots of communications and programs out there. And the coalition really wanted to help coordinate and kind of provide a container for this booming conversation, really. And then the last focus area really, of course, is to encourage voter participation on election day, and that the public feels empowered and encouraged to do so and is able to keep themselves safe and healthy as much as possible. The coalition is really interested in strengthening relationships across organizations, working together collectively, and really bringing our experience as public health professionals to election officials, and really kind of connecting these two fields and seeing what is it we can do to promote safe and healthy voting. So next slide. where I get to brag a little bit about all of our great coalition members. Again, we are explicitly nonpartisan and focused on sharing guidelines and recommendations on how to safely vote during this public health emergency, encouraging voter participation, encouraging civic engagement through poll worker recruitment, and really focusing on the nuts and bolts of how do we do this safely. So again, we're a non-issue campaign. We don't support any candidate or specific issue. We're really just focused on keeping the voting process accessible and healthy and as predictable as possible, if I dare use that word in this year. On the next slide, I actually want to share a really neat opportunity. One of our coalition members, healthyvoting.org, is offering to ship printed materials of their healthy voting pocket guides and posters. These materials are also nonpartisan, state-specific, and available in both English and Spanish. And I don't think Zoom slides are clickable, so I'll have to see if I can drop that link into the chat here shortly. But if you're interested, please go to that link and you can fill out a request, and they'll send you these guides. They have, again, posters and then these little pocket guides. If you also wanted to do it one-off for yourself or potentially for friends and family, if you go to healthyvoting.org and look up your state, you'd be able to download that one-off. So here's your freebie for today on how to vote safely and healthfully. And we hope that you'll consider putting in a request for these materials. Healthy Voting says that these are especially useful in any setting where people are interacting with health and service systems. So testing sites, flu shot and vaccination clinics, hospitals, food banks, shelters, assisted living facilities, really any of these places where you have folks interacting with services. So thank you, Jess. I see the document coming through, or that link coming through. So please do submit as soon as possible. November 3rd will be here before we know it. And then on the next slide, just to see, if you want to see more about VoteSAFE Public Health, if you have questions for us, want to join us, want to hang out with us, please visit ASTHO.org/VoteSAFE Public Health. We have social media tools for you to use, including graphics and sticker templates in both English and Spanish. We have sections tailored to voters, public health professionals, healthcare professionals, and election officials. We also link, among other resources, we link to the CDC resources on voting that Wendy mentioned a few minutes ago. So if you don't remember CDC's URL, maybe you can remember ours. But please reach out to either through the website or to reach out directly to our senior advisor for the project, Jean Ayers, at JAYERS@ASTHO.org. We'd be really excited to hear from you. And then my next slide is just a reminder to please wear your mask, take your sanitizer with you, make a plan to vote healthfully. And thank you so much for the opportunity to present this. I'm really excited now to turn this back over to Amy to wrap us up with questions and then final announcements. So thank you. Thank you.